Welcome, ladies and gentlemen. Thank you so much for your great support always. I'm so grateful for your continued support to this channel. Thank you so much, ladies and gentlemen. As you speak, the doctors are now saying that DUALE is unfit to be the CS of Health Ministry. This comes after immediately the appointment of DUALE was gazetted. DUALE went ahead and said that SHA is working, and those who castigating the SHA, these are cartels. But doctors are telling DUALE like this: it is not cartels who are castigating the SHA. It is Kenyans, and also we as doctors, we are experiencing the difficulties with this so-called SHA thing. Listen to the KMPDU.
The doctors have said the Social Health Authority is only working for political leaders. It's only working for the ministers and it's only working for the people in government. To the point that the newly appointed minister was saying yesterday that it is the cartels that are saying the Social Health Authority is not working. We want to tell the new minister that all these doctors we have here are from the 6 counties in Central. And they have said they have patients who are in the hospitals who cannot pay bills because the SHA amount that have been put for the cancer patient has been exhausted. We have these doctors who are reporting that in public hospitals, for the first time it is being reported that in the ICUs, the families have to sell land and sell properties in order to pay the bills. SHA is not covering that. That's for the first time in public hospitals that patients cannot access outpatient services if they're not referred. These persons, or these people these patients are actually detained. They can't get services. People are actually suffering. So yes, the benefit packages must be sorted out. We are also saying we have doctors. We have a doctor from Kiambu who has stage 4 lung cancer. And this doctor, we have to make calls every day to get services. So in reality, the Social Health Authority is only working in the dreams of those who have been appointed to ministers and to permanent secretaries and to the MPs because they have a different private hefty medical insurance. So it is not working, and as a new minister, make it work. Don't politicize it because everybody has been politicizing this.
But earlier on, DUALE had said that those who are castigating the SHA thing, these are cartels. And so he's going to deal with these cartels. It is no longer Kenyans who are rejecting the SHA, or rather, it is not that now DUALE is telling us the system has failed, but now those who are castigating the SHA thing is cartel, or rather they are cartels. So the doctors are saying the appointment of DUALE is unfit, and this is going to destroy the health ministry forever and ever. Before we watch DUALE, as you always do, ensure you like the video. When you like the video, you automatically support the work that I'm doing in this channel, because sometimes you watch and you forget liking the video. So this is just a reminder. As you watch, please consider liking the video. Thank you so much for that like.
To assure that the people of Kenya, that it will be the end of corruption. I will face cartels. I have full mandate from the president to make sure that I work with the men and women in Afya House, not for their own individual interests. So those who have personal interests, I think they better come to their senses, and before Tuesday, they make a decision, either to work for the national interest of the country or to work for personal interests. If you are working for personal interests, then you have no space in Afya House. I'm saying let us revert back to NHIF. Those are the cartels. I can tell you. SHA is working, and that's why I've gone there, and I want to assure the people of Kenya that SHA will work.
DUALE, remember, for the first time, he was appointed as the CS of Defense. Later, he was reshuffled and reassigned to the Ministry of Environment. And now, as I speak, he has been reassigned again to the Ministry of Health. The question is, when Aden Duale was fired as the CS of Defense Forces, then immediately William Ruto dissolved his cabinet during the Gen Z's demonstration. Aden Duale remained as the CS of Defense. So, we are being told that the defense, KDF, rejected Aden Duale. This forced William Ruto to reshuffle Aden Duale, giving him the Ministry of Environment. When you look at the issue of environment, there was this issue of Karura Forest, and a lot of issues came in with Aden Duale. Now, immediately for him to be reassigned again, thirdly, in the Ministry of Health, now the doctors are saying Aden Duale is unfit. The truth to be said, Aden Duale is a man that is not going to deliver in health ministry. Because yeye ameingia pale na politics, politicizing everything, not knowing the trajectory and the issues that are there that doctors are trying to address. Doctors are saying, sisi ndio tunawatibu wagonjwa. Yale wagonjwa wanapitia tunajua. This issue of SHA thing is not working. So when Aden Duale is coming out to say that it is cartels, or there are cartels who are disturbing Kenyans about the SHA, it is a lie. It is a lie. And so if he's talking about members of parliament, their families are being treated well. Remember, members of parliament are having different kitty. They are not paying SHA. They have private thing, some insurance there that is catering for them. So when you see Aden Duale saying that, but MPs, their SHA is working. MPs are not using SHA. They have their private kitty that is catering for their issues of health, you know, and they're contributing money there. So Aden Duale ameingia tu na maneno na vurugu. Na doctors wameamua kwamba we are not going to tolerate this guy. This guy hajatosha mboga. He is unfit. He is unfit. If already doctors have said that we are not going to work with Aden Duale, the way he's trying to portray the SHA thing and the issues of health, ministry. You want to tell me that Aden Duale is going to succeed? You want to tell me that Aden Duale is going to change anything in the Ministry of Health? Nothing. The man is just there, assigned or reassigned politically, illiterate. He doesn't understand anything. He doesn't understand totally anything about that health ministry. So yeye kuingia na kuanza kulima madaktari na kulima, yani yeye anasema wale wana complain in cartels. In other words, hata madaktari ni cartels. That is what Aden Duale is trying to say. So I think the appointment of Aden Duale and some individuals in these ministries, it is just politically activated. Politically activated. And I don't think if William Ruto is going to succeed with this such kind of individuals, who does not even know, and they don't understand how to handle these individuals in health ministry. It is not going. In fact, the health ministry, it is disaster. Leave alone the ministry held earlier on of defense and the Ministry of Environment. The health ministry is a disaster. And if it's not going to handle it carefully, Aden Duale is going to be kicked out. What do you think? Drop your opinion at the comment section below. Otherwise, thank you so much because of your great support. Please consider subscribing, liking, commenting, and sharing this video till you meet in another video.